Good evening. It's something that has not happened in this province in more than 35 years.
A child has died of the measles virus. Officials say the child lived in the Hamilton area, but details about the case are scarce. CTV's health reporter Pauline Chan joins us in the studio with the latest. Pauline.
Thanks very much, Michelle and Nathan. Well, we don't know the exact age of the child, but health officials say they were not immunized. And Ontario has already seen 22 cases of measles in 2024, more than triple the total last year. The Hamilton child was under the age of 5, was not vaccinated, and had been hospitalized.
It's devastating when a child dies from particularly something that's a preventable illness, that we have good and safe vaccines that can help prevent these tragedies.
Measles symptoms typically include a runny nose, high fever, cough, red watery eyes, and a red rash lasting about 4 to 7 days. The measles, mumps, and rubella vaccine is typically given at 12 months of age, with a second dose given around 4 years or before the child enters a school environment. The Public Health Ontario report from May 16th shows 22 measles cases in the province so far this year, with 2 of those cases in children under the age of 2. 7 were in kids age 1 to 4, and there were also 7 cases in people aged 20 to 39.
This was in Ontario. It's important to remember, too, that there are over 130,000 deaths per year from measles around the world.
Dr. Isaac Bogosh says measles can infect key parts of the body like the brain and is often followed by other infections like pneumonia, which can be lethal.
Measles is a profoundly immunosuppressing virus.
Dr. Dina Kulik points to recent gaps in vaccination programs due in part to the COVID-19 pandemic.
There's lots online and social media and on the internet that says that these illnesses are quite benign, that your child will likely not get infected, that they rarely cause significant illness or death, and that simply is not true. About 1 in 1,000 children with measles will die from that illness. That is a very significant and real number.
Ontario's health ministry issued a statement today saying, "Our heart goes out to the family that has tragically lost their child. Our thoughts are with them as they navigate this challenging time." This is the first reported measles death since Ontario began keeping records 35 years ago in 1989. And measles was declared eradicated in Canada in 1998 thanks to a successful vaccination program. But the current situation has health officials concerned. So if you don't have a family doctor, you can contact your public health department to make sure you and your family are fully protected. I'm Pauline Chan.
Their ship has escaped, Your Eminence.
They're just too fast.
Don't worry. Good things come to...
He's frozen again.
Classic cable empire.
The dangers of childhood measles are hitting home today.
Public Health Ontario confirming the death of a child under the age of 5. Let's bring in our health reporter Pauline Chan to tell us more about all this. Pauline.
Well, Nathan, Michelle, Public Health Ontario has been publishing these statistics since January of 2013. And since then, there have been no measles-related deaths until now. Public Health Ontario reported the death late Thursday, a child under the age of 5 who had been hospitalized with measles.
It's obviously tragic anytime we hear of anyone succumbing to an illness, especially, of course, a child, and especially, of course, a vaccine-preventable illness.
Measles was declared eradicated in Canada in 1998 thanks to a successful vaccination program. But in other parts of the world, measles is still endemic.
This was in Ontario. It's important to remember, too, that there are over 130,000 deaths per year from measles around the world.
On Wednesday, a measles case reported in Mississauga put Ontario's measles cases at 22 this year, compared to just 7 for all of 2023. 13 cases were in children, and 12 of those had not been immunized. 1 had unknown vaccination status.
It's also important to take a step back and recognize that this is a broader issue in healthcare and public health. You know, we're having a pertussis, also known as whooping cough, outbreak in Newfoundland, and southern Alberta had one in the summer. And, you know, it should come to no one's surprise that if you see a lapse in routine childhood immunizations, that shortly after you're going to see a resurgence of these vaccine-preventable illnesses.
And Dr. Bogosh emphasizes the importance of getting your child's full range of vaccinations. And a spokesperson for the health ministry has issued a statement saying, "Our heart goes out to the family that has tragically lost their child. Our thoughts are with them as they navigate this challenging time. We remind all Ontarians to stay up to date with their vaccinations to ensure themselves and their loved ones are protected against infectious diseases.